The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Welcome to Aging Horizons. On today's show, we'll be talking about the importance of getting vaccinated for the variety of issues that individuals face when you're over age 60 plus, or if you're part of a special population. We're talking about COVID-19. Yes, it's still around. Yes, we still need vaccinations, but we'll be talking about shingles and pneumonia vaccines too. It's important information. Stay tuned.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. I'm your host, Brian Lamore. And on today's show, we'll be talking about the importance of getting vaccines for our elderly population and special populations within that group. There's a special project that is going on in which they have written funding for a grant in order to, I guess I'd say in a unique way, to educate and get vaccines to people. This is brought to us by the Aging and Disability Vaccination Collaborative at the University of Montana Rural Institute for Inclusive Communities. And we have some wonderful guests with us today. We have Meg Tracy and Tanis Hargrove with the program. Welcome to the show, you two. It's great to have you here.
Thanks for having us.
Great. Well, Meg, let's start with you. You're the grant writer for this program. So you saw a problem out there and you noted that you have resources, so you wrote a grant. Well, let's start at the top. And what is the problem and how does the grant help address these issues?
So the issue is that there are people in Montana who are at higher risk for severe impacts of different diseases that we can really try to prevent or make the impacts less severe through vaccinations. And so many of Montanans want to get vaccinated, but there's lots of miles to travel. The locations of some of our vaccination sites are not as accessible as they need to be because we're a rural state and we're all working on that. Some people communicate differently. People who are deaf or hard of hearing, or people who are blind or low vision, and they need some additional communication supports to understand what vaccinations are needed. So there's been an effort really to build out from our traditional public health and pharmacists and our healthcare providers some trusted partners to really help those primary partners for getting vaccinations to people who need them most. And the trusted partners are our University Centers for Disability, our assistive technology programs, our Centers for Independent Living, Aging Services, our Aging and Disability Resource Centers. And so an opportunity was presented to this network nationally, and we organized with some of our partners to be a part of that funding opportunity and to really get resources out to our primary partners, our pharmacists, our healthcare providers, our immunization sites at our local and tribal health departments, and really support them as trusted partners who have reached to older adults and people with disability, and really try to help get vaccines to the people who need it most.
Well, that's great. Well, Meg, let's go with you because you're the one that is kind of putting this into action, I guess, boots on the ground. And you're working with different groups to actually get the vaccines and the information out there. How are you doing that?
Well, I'll just start, and then I want to turn it over to my dear colleague, Tanis. As a University Center for Disability, our particular role is to provide opportunities for our students to really learn what is needed in Montana and to have as many opportunities to be working with community partners on the things that people might need most. And so for us as a university center, we couldn't do it without our Pharmacy program, and you'll get to meet Ken in a minute, but I'm going to turn it over just a little bit because Tanis has really been coordinating some of our other trusted partners on this project, and they bring other points of view, other resources into this collaborative.
Okay, great. And Tanis, go ahead.
Okay, cool. Hi.
Hi.
Yeah, I think one of the things that's really unique about the Aging and Disability Vaccination Collaborative is that, we're reducing barriers in very real ways. And a lot of those ways include in-home vaccinations. We're able to provide transportation to and from vaccine clinics. We're able to have Ken, who has a special mobile certification for the Pharmacy, and Ken can travel to various locations throughout the 21 counties in the service areas for our Centers for Independent Living to do mobile clinics. And mobile clinics can look a lot of different ways. They can be at a senior center, they can be at a public health department, they can be, at the Adams Center or something like in Bozeman, like the Brick Breeden. So it's a really unique opportunity to provide really community-based supports that also one of our goals for reaching older adults and people with disabilities, as well as other vulnerable populations, is making sure that the access barriers, we reduce access barriers by making sure that we have accessible locations, doing our best to really get the word out to help educate people and conduct a lot of outreach about vaccines and the importance of vaccines. Like you said earlier, COVID's not going away. But we are also offering COVID-19 vaccinations, but in addition, we're offering flu vaccinations, RSV, pneumonia, shingles, and Ken can provide any vaccines that people need.
Mm-hmm. And what's really nice is that you provide all the vaccines that an individual, a senior would need. And many times people are not sure what vaccines they need to get, right?
Yes, that is 100% true. It's really hard to keep track. And we're all doing our best with all the different medical softwares. So we're trying to sync those up. But one of the nice things that Pharmacy students and also Ken, as the pharmacist, can do is they can provide immunization reviews. So they can help you look up which immunizations that you've had and help you figure out what might be best for you. And at those mobile clinics, because we're really dedicated to experiential learning for the students, they really have the time to sit down with folks and talk through that immunization process and immunization review. Mm-hmm. And in addition, they're also offering medication management. So for individuals who would like to talk to a pharmacist about their medications, they can bring a brown bag full of all their medications, and Ken will offer that medication review for them. And that is also part of the mobile clinics.
Yeah, and what I think is great is that you're tying this in with college students, so you're continuing their learning, which many times there's book learning and there's real life learning, and you're providing that, which is nice. Well, we've quickly drawn to a close on our first segment. We have two more guests for our next segment, but we'll continue our discussions about the importance of vaccines for seniors and how we're working in a unique way to deliver that to Montanans. So stay tuned.
Montana veterans, your independence matters. The freedom to age with dignity, how and where you want, for as long as possible. Please help us improve long-term veteran care in Montana by taking a short online survey. Go to veteransurvey.mt.gov. Your long-term independence is our priority. Go to veteransurvey.mt.gov and help us get it right, Montana. This message brought to you by DPHHS, the Montana Veteran Affairs Division, and this station.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
I was angry and upset when the doctor told me I have diabetes. I just didn't want to deal with it, the needles and the diet restrictions. But after I started to learn about it, those feelings changed. I was at risk for a heart attack caused by high blood sugar. That got my attention. I started watching my diet and making sure I got enough exercise every day. I want to be around for my grandkids, and now that I know what to do, it seems like a small price to pay.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. We're continuing our discussion about vaccinations, particularly amongst seniors, and how maybe that can extend out to other family members who might give an illness to an elderly person, or they might give it to them. Joining us now is Ken Chatwin. You're a doctor at Pharmacy, School of Pharmacy, and there's a lot of different vaccines that we recommend that a senior should get. What are those, and when should we get them?
That's a great question. There's many vaccines that are eligible to our older populations. This doesn't include, obviously, our COVID-19 that we've had so much media presence with, but it also includes pneumonia vaccine, shingles, RSV, and even shingles vaccine that can be eligible. As for the timing, it's very patient-specific, so it depends on how much they've been vaccinated in the past, and where we need to go to ultimately protect our patients to the best of our possibility.
Mm-hmm. And we're hearing now that we should get a second COVID vaccine. So if we got one in the fall, where we kind of, I guess that's when it spreads a lot, now in the spring we should get a second one?
Absolutely. So yeah, just last week, the Centers for Disease Control did announce that there is a recommendation for those older adults age 65 and older that they're eligible to receive a second booster shot for the COVID-19. Mm-hmm. Now, this is more of just a general recommendation. It's not a hard, you need to go and get one, but ultimately we really need to look at our patients who are most at risk. Our older adults, obviously, but especially people with disabilities or those who have compromised immune systems, will put them at a higher risk for severe disease. So we want to make sure that we're reaching out and protecting those individuals to the best of our ability.
Mm-hmm. I know I've gotten all my COVID shots, and I've gotten it 3 times, but it was more like a stomach flu for one day. I mean, I was surprised that the test came back positive, and I've known people who passed away because they haven't gotten shots. But the U of M is working with a variety of different student projects to do mobile vaccine clinics around the state. Who are we partnering with, the students, what different groups, and how is this working and coming about?
Yeah, absolutely. So working at the university, our first and primary concern is the education of our students. So being included in this grant and the opportunities that it gives our students are just amazing. Obviously, our pharmacy students are involved and giving vaccines, but we've also been able to partner with our nursing students around Montana, as well as our physical therapy departments, and really teach the students how, when they graduate, that they're going to have the tools necessary to offer optimal patient care so they can do the best job they possibly could.
Mm-hmm. And there's always a question that comes about somewhere, I don't know where, but about the safety of these vaccines. And just comment more about that, please. Set
Absolutely.
Us straight.
And I think that the media has done a great job portraying both the good and the bad, but it depends on who you listen to, whether you're getting that right information. And that's another goal of this collaborative, is that it makes it seem like we're just doing these mobile clinics and we're going jabbing people left and right. But that's a piece of it, and it's an important piece. But a more important piece is the actual education. So we're providing education on the vaccines that people are receiving, making sure that they're warranted and necessary for the patients. But then we're able to also look at giving information about the disease states themselves, about why the vaccine may be important for that specific individual. And it's amazing to give individualized care and really dispel some of the myths and rumors out there, especially following some of the vaccines and especially COVID, to make sure that our patients, if they choose not to get a vaccine, that they're doing so because they're informed and they're informed correctly.
Exactly. They're informed correctly because there may be a certain population that's more at risk than getting it. But I believe in science. Hey, I trust you guys, so I get all my
Man after my own heart. Perfect.
Yeah, because I don't know your side of things. But there could be some side effects. Are the side effects long-term? Are they kind of short-term? Are they more of a nuisance? Or could they be a serious problem?
The vaccines, for all intents and purposes, are very safe. But not only are they safe, but they're really effective. I think most of us have gotten a COVID shot at this point in time, and a sore arm seems to be the worst side effect. And some people may amount to better immune response, and they might be punked out for maybe 24 to 48 hours. But it's usually just fatigue and just kind of not feeling good, maybe a headache. I guarantee that the disease is much worse than the vaccine, especially when we're talking about educating on long COVID symptoms, where I know of many colleagues, friends, and family members that still can't taste or that are having reactions well past months of being on COVID. So the vaccines are very safe and effective with very minimal side effects.
Yeah, I have friends who didn't get the vaccines, got the disease, and they're not with us anymore. And a minor effect would be the pits. But you also are working with this mobile vaccination group that you could, in certain circumstances, bring the vaccines to the individuals in the home if they are unable to come to you. Tell us more about that.
Yeah, absolutely. With the mobile initiative, it's an amazing opportunity because what we found through the COVID pandemic is having set up clinics are great, but sometimes bringing the vaccine to where the people are is much more effective. And especially when we're talking about people and our older adults that might have mobility issues, we're talking about people with low vision or they're blind, it may make it very difficult to go and seek out vaccines. What we're trying to do is remove those barriers to care. And we can go to home visits, we can go to community centers, we can really meet the people where they're going to be to make sure that we're cutting down those barriers and we're vaccinating those people. Because like you said, you have friends that may have passed away. We don't want that to happen to our fellow Montanans. We want everybody around living a long, happy, healthy life. And if it's education or vaccination, we're there for them.
That's great. Well, Ken, thank you so much for being on this segment. We have another segment to go. But an important point is that if you're a senior, it's probably paid for, these vaccinations. So there's no money out of your pocket. You just have to roll up your sleeve. A lot of great more information. Stay tuned. We'll be right back.
Perhaps our regular viewers have noticed that we've been missing a host for the last several months. In July, our favorite person, Kimmy Everman, unexpectedly passed away, and we'd like to take a few moments now to share some memories that we have of her.
For many of us, watching Aging Horizons with Kimmy as the host was like talking to a friend, and for Kimmy, that's exactly what it was. She cared about all of the viewers of Montana on Aging Horizons as if they were her personal friends. She wanted each of us to live the best possible life and connect to as many services as possible. She had no greater joy in life than connecting advocates to others that could help Montanans across the state with problems that they maybe didn't know as much about. Losing Kimmy was a great loss to the state of Montana, but the work that she did will live on in the hearts and minds and Rolodexes of so many of us at the state.
So working with Kimmy was always a very fun experience for me. She lit up a room with her smile, and I loved her giggle. She had this giggle that was the cutest, most happiest spreading of joy that I could describe. She also was very passionate about her work, about helping veterans, and about her dog, Sophie.
Kimmy's been my friend, my coworker, and my mentor for over 20 years. She has taught me so much about not only Medicare, but working with people. She had a great sense of compassion and love, especially for veterans, animals, and the underdog. She loved working with seniors and people with disabilities. That was her heart. She will be greatly missed.
Aging Horizons have been on the air for over 30 years, and I've had the pleasure of working with these wonderful ladies and everybody in senior long-term care that length of time, including Kimmy Everman. And whenever we got done with the show, I just loved her laughter, which everybody's commented here. It was like we're getting away with something. Isn't this fun? And I will sincerely miss both that and her.
Welcome back to Aging Horizons, and we're continuing our discussion about the importance of vaccines, for seniors and individuals, plus special populations. We're partnering with the University of Montana and different organizations inside Montana to address their population needs. Joining us now with the Ability Montana Chief Executive Officer is Scott Birkenbuhl and Summit Independence Living Executive Director Tammy Hoare. Welcome to the show. It's great to have you both here.
Thanks for having us.
Great. Well, Scott, let's start with you. Please tell us what the objective is of your organization, Ability Montana, and how you're working with the U of M to vaccinate your population.
Well, Ability Montana is a Center for Independent Living, and we serve people with disabilities across Southwest Montana, all ages, all disabilities, and we provide multiple services, everything from information and referral for folks when they're looking for information about services that are provided for people with disabilities, and independent living skills. We do a lot of advocacy work, both systems advocacy. We lobby the state legislature, the federal government on all kind of issues that are revolve around people with disabilities, as well as we do have a peer program where peers, other individuals with disabilities, are working with other people with disabilities to help them find their way. And in fact, all Centers for Independent Living are peer organizations, and over 50% of all the employees are people with disabilities. Over 50% of our board of directors are people with disabilities. So we're truly people with disabilities helping other people with disabilities find their way.
Mm-hmm. And with Ability Montana, you probably really realize the importance of vaccinations because your populations, is it true that they might be a little more vulnerable to different diseases? And does it spread a little quicker in your populations?
Those things are probably both true. Mm-hmm. And what we do a lot of is we do a lot of educational work and giving people with disabilities their options. And trying to dissuade all the myths that are around various vaccinations these days, as well as so that they can make an informed choice for themselves, so that they can they can determine what their direction their life is going to be, and have the choice, and we can help them facilitate their choice. Or that's, particularly around the vaccination collaborative here, that we can help provide transportation to clinics. We can we'll help the University of Montana. We're going to help facilitate their clinics when they have them, so they have enough manpower capacity to do them. Our staff will come and support those clinics while they're going on.
Mm-hmm. And I like what you say is that they can make the choice themselves. It's not that you're deciding for them, which is so important, and it really enables them to make proper decisions. Now, Tammy, let's go to you. You're with Summit Independent Living, and you're the executive director. And kind of the same question, what populations do you serve, and how important is vaccinations, and how you work with the U of M?
Yeah, so the same as Scott, we're both Centers for Independent Living. And what that means is we're non-residential. We don't have homes. We're not a nursing home. We're not a facility. We work with people with disabilities of all ages and and all disabilities, and working with folks to help them remain as independent as they choose to be in their communities. And so, again, like Scott said, it's helping people navigate those pathways and choices, and helping them find what services are available to them, and helping educate them on what those are. And one of those right now that we're talking about is the Aging and Disability Vaccination Collaborative. And so we're helping people get access to those options, to get those vaccinations, or at least to be educated on what those options are. And as our service area is 7 counties in the northwest part of the state, so very rural, but also some of our more urban areas like Missoula and Kalispell. So we're working really closely with all of the public health departments and helping them do some outreach and education to folks in the communities. And like Ken said, also it's about education, so making sure that people have access to that information. And one way we're doing that is having it available on our website, so folks can come there. There's resources available, other links to other information. So just making sure that people have the choices available to them, and then they can work with us on finding other options to help them remain as independent as possible. And one of the main barriers that we find for people with disabilities, especially in Montana and the more rural parts of Montana, is access to healthcare. And that's one of the things that this grant is helping us do, is to find those barriers and to help remove some of those barriers.
Mm-hmm. And some of the communication issues are, sometimes people can't read, or they can't read fine print. So you're working to get to them the solution for how they need to get information, right? And that's many different avenues, which many people might not think of.
Right. And so, in offering some mobile clinics and bringing some of the vaccination opportunities more, bringing it to the people, then we can also provide some assistive technology, interpreters, different things like that. So again, it's finding out what the people need and what those barriers are, and then trying to help find a solution to that. Mm-hmm. And that's a lot of what we do. Like Scott mentioned, we do a lot of advocacy and resource development, and helping individuals find what those resources are and how that's going to help them be independent.
Mm-hmm. Well, Scott and Tammy, we're drawn to a close on the show. I'd like to thank you, because you're doing an excellent effort in advocacy for your populations, particularly on the issue that we're talking about now, is vaccinations, how important it is to get them. But, you can choose not to if you choose to, but make sure that that is an informed decision. And I like the different ways you're outreaching to your special populations to get them that information. So thank you for your advocacy.
Thank you for having us.
Great. And for our viewers, an important topic we've had here is education on vaccines. If you're not going to get the vaccine, make sure it is a well-informed decision, but vaccinate up. It's the best thing for you, I think. So thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.